With all that said, I'm excited to introduce today's first session. This is a fireside chat that's featuring Jyoti Mehra. She's the Executive Vice President of Human Resources at Gilead. She's responsible for leading people strategy and building an inclusive and collaborative culture. Prior to joining Gilead in 2017, she had senior leadership positions with Novartis in the US, Europe, and China, and brought a broad international perspective to her work there. Interviewing her will be Michal, Lev-Ram. She covers technology and entertainment for Fortune. She writes both features and in-depth stories about the biggest personalities and trends within both industries. She's also contributed to CNN, Money, Fast Company, Popular Science, and many others. Welcome again. Thank you for being here, and please join me in welcoming you to the stage. Thanks again.
Good morning, everybody. Jyoti, thanks so much for joining us.
It's a pleasure to be here.
So we have a lot of different topics to get through. I want to just start asking a few questions about leadership, and a really simple one, just table stakes. How do you define leadership in your organization? And I'm pretty sure you are all familiar with Gilead here, but maybe give us a little bit of context also for the company.
Thanks, Michal. Great to be here. Hi, everyone, on this kind of rainy morning, and hopefully the weather is going to clear up and the sun will be shining. It's such a pleasure to be here. Let me first start by sharing a little bit about Gilead, who we are as a company, and then talk a little bit about how we think about leadership at Gilead. So Gilead is it's a global biotechnology company based here in Foster City. We are just over 35 years old. We have 18,000 employees in more than 32 countries around the world. We are a company that leads in providing healthcare and solutions, particularly in the virology space. So if you think about COVID-19, and you think about one of the drugs that we innovated, it was Veklury remdesivir, which you'll remember, it was an oral medicine for COVID. But we also make medicines in oncology, and we also make medicines in other areas like inflammation. So we have been on a bit of a cultural evolution and journey as an organization for the last several decades, but particularly over the last 5 or 6 years. And some of that evolution is shaped by how we think about leadership at Gilead, Michal. So back to your question. And for us at Gilead, we believe that everybody leads from the seat that they sit in. So, and that's an important principle for us, because at the end of the day, the way that we think about our company culture is, there are two big elements. Our products and our people are really what drive innovation at the company. And we want to have a high bar for science. So in our pursuit for that high bar for science, it's really about everybody leading from the seat that they sit in the best interest of the patients and the community that we serve. So it's this concept of democratized leadership, and really ensuring that everybody feels empowered to do that from their seats.
Just a quick follow-up question.
Yeah.
Why this shift and this evolution? Why did you see a need for it?
Yeah, so one of the reasons why we as an organization have been successful in bringing medicine to so many people around the world is because of high innovation and high science. And as we navigate this fairly complex world, including some of the recent changes that are happening from an external perspective in the new administration, it's clear that there is space for innovation, not just in the science, but also in how we bring those medicines to the people. So, while innovation and high science is critical and leadership there is critical, that innovation only goes so far if we cannot bring those medicines in the hands of the people that need it. And that's why we really thought about expanding this definition of leadership, because we want to lead in the science, but we also want to lead in access, in commercial delivery, in finance, in human resources. So that was really the rationale for why we were expanding this definition.
Okay, and help us understand what this actually looks like and feels like. How do you, other than saying everybody's a leader, how do you make that happen? How do you actualize it?
Yeah. So one of the ways in which we do that is as a company, we've always had our core values. In fact, the last time we changed our core values was in 2015 when we added inclusion as a core values. And I'm sure many of you that work, each of your company has some set of core values. What we did about 5 years ago is, as we thought about leadership at all levels and in all roles of the organization, what we did is we codified what we call leadership commitments. It means everybody in the company has 5 behavioral elements that are core and essential to the commitments that we are making to one another in the organization. And those leadership commitments apply to every employee, all the 18,000 employees in the company. So, and those leadership commitments are embedded in our culture, they're embedded in our performance management system, in our reward systems, in how we conduct meetings and discussions with colleagues, how we think about development of leaders in the organization. And those are like codified leadership behaviors that we want every employee to aspire to, sort of demonstrate in the organization. And I can be specific on what those are. So the 5 leadership commitments that we have is for every leader in the organization to be bold. So these are I statements. So I am bold, I care, I trust, I own, and I listen. So those are 5 behaviors that we expect every leader in the organization to demonstrate.
Has this changed, by the way, like the way you approach meetings, for example, or any other communications?
Yeah, so definitely meetings. We also have, how we make decisions. We think about that. It was interesting, just as we had introduced this, of course, we had no idea we were getting into the pandemic and some of the, deepened focus around inclusion and diversity and all of those things. But these leadership commitments were particularly important as we got into the pandemic. So how leaders in the organization demonstrated care for one another during pandemic became really, really critical. On the inclusion topic, which I know we'll talk more about, how we demonstrated care for one another and trust in one another became really, really important. So those are just some ways in which we continue to highlight those across the organization.
Okay, great. Let's talk more about inclusion. We're not going to get too deep into politics because that would take all day. But I do want to know, just for starters, how do you think about the political polarization and what we're seeing around DEI? How does that impact the way that you approach it, if at all? Definitely impacting how I think each one of us is thinking about it. And I think it's a topic it's top of mind for many of us around this room as well. So maybe stepping back, I'll say a couple of things. At Gilead, and this predates even my time with Gilead, at Gilead, we have always led with inclusion. And in fact, we don't call it D&I, we call it I&D. And the belief is that if we are more inclusive as an organization, we will have greater diversity in our workforce. So that's how we think about it. To your question around the political environment and the polarization, we are very clear that our mission is creating possible for people and patients around the world in terms of healthcare outcomes. And the people and the patients that we serve are from all communities in this world, right? Not just in the US, but also ex-US. So our patient needs, the people that we serve, because we not only make medicines, but we also have preventive medicines, the patients and the people are pretty diverse, and we cannot understand those healthcare challenges if we don't have that same diversity represented in our workforce. So that's how we think about that. And in order to do that, we will go and source talents from the places where we can get this diversity. And then the most important thing is when you bring that diversity in, how does that voice count, right? How are they part of the innovation process within the company? And that's top of mind and important. So our commitment to inclusion remains unwavering because it is a business imperative for us. And therefore, when we think about the political context, we are very grounded that at the end of the day, in fact, we have reinforced that our commitment to inclusion is going to still remain paramount. It's not a core value that's going away.
We believe in inclusion, not just in terms of gender and ethnicity. In fact, we have continued to expand our definition of inclusion. Just last year, we launched an employee resource group on disabilities because of the number of people in the workforce that have these different abilities, and they're an important component of inclusion. But it's sort of, I think about the above the waterline and below the waterline on inclusion, right? There are elements of diversity that we can all see, and then there are elements of diversity in terms of thinking style and our functional experiences that are less visible, but super important for us as a company when we think about innovation.
Can you share, you mentioned the employee resource groups, can you share another element, something that you've put in place at the company that you think has had a lot of impact on promoting greater inclusion?
Yeah, so there are maybe a couple of examples that I could give you at Gilead. So one I would give you as a business example, and one I can give you from the HR practice as well. So on the business side, one of the cultural elements that we've been trying to strengthen is how do we make quality decisions at high speed, right? Because we ultimately have somebody waiting for our medicine on the other side. So quality decisions that are high speed decisions. And we introduce what we call a decision-making model. So many of you have different decision-making models in your organization. We use the DAI, which is, who's the decision maker, who's the advisor, and who needs to be informed. For us, that was really, really important. And while the role of decision maker is really important, when you run these processes and these practices in an inclusive way, we actually highlight the role of the advisor. As an advisor, you have a big responsibility to provide input to the decision maker. And in fact, our CEO, when we have made some very important business decision, will go around the table and ask for input, whether or not it's your functional area of expertise on how must we navigate this healthcare challenge. So the role of advisor is one way in which we practice inclusion and making sure that every voice counts. The other example, because many of us here are HR professionals, I'll give you is in the HR space. So our employee resource groups work very actively with my teams in HR to ensure that the way that we practice, for example, even things like our benefits are very inclusive of our workforce. And the example I'll give you is one of our most active employee resource group is Women at Gilead. It has the highest membership in the organization. And the women at Gilead, because we have, just for context, we have women that are out in the fields promoting and selling our products, right? So these are in the sales organization. They actually worked with my team in rewards to define a benefit program for new mothers that were not able to consistently breastfeed their child when they were traveling for these sales calls. So we actually had a new program that we introduced which allowed them to send the milk back to their home. So it was a service that we introduced so that while they were traveling for work, they were still able to sustain whatever pattern they wanted to at home. So that's just another example of an inclusive benefit and approach that was really important for our workforce.
Great. Hopefully it didn't get mixed up in the mail and routed to somebody it wasn't intended for. It's a funny package
Not
to
yet.
get if you're not expecting it. So, okay, let's go to change management. You mentioned, obviously, COVID, the company sort of evolving through that. What are some of the big shifts that that you think the company is going through now? I mean, is it mostly on the political level with the new administration,
Yeah.
or are there other evolutions?
Yeah. So as a company, and I'm sure many of you have been through lots of up cycles and down cycles, as I mentioned, we are world leaders in virology. And that's the foundation of our company. It's a company that has cured hepatitis C. It's a company that has brought curative therapies for certain kinds of cancers through cell therapy. And it's a company that is really devoted to research and development of other products. So one of the things, while we have been focused on virology, just stepping back, right? One of the things that we've been focused on is really diversifying our business. And as you know, within the HR space, all our enablement of change has to be grounded in where is the business moving. And in that diversification strategy of the business, we have had to really manage change by ensuring that we are bringing in capabilities for the future In some cases, as you can imagine, skills are fungible, right? If you need somebody in finance, whether they're supporting oncology or virology, it's the same skill. But in other cases in science, we have had to really go out and buy some talent, right? So that's been part of our change journey, where I think it was a couple of years ago, it was our biggest hiring year. So remember, we are 18,000 employees. We hired over 4,500 people in that year. So that was like a big year of change, or the upcycle that we really navigated, because we needed to buy some of these skills to really support our portfolio and expansion. I will say some of the other changes that we have had is, as we have invested in some of the high growth areas for us, we've also had to manage, the impact of rationalizing those investments in some other areas. So, we have had to manage some reductions in workforce as part of that, which is some process that we went through late last year to really support our portfolio and expansion. And those are never fun, but those are changes that, of course, we're having to navigate and manage through as well. So there are these, some of these are external factors, like you mentioned, on the political aspects, which, by the way, is not just inclusion and diversity, as you can imagine. There are also things that impact us in terms of pricing of drugs. So drug pricing is a big component. How the US government is thinking about some of the programs that have been in place to support some of these challenges ex-US, whether it's the UN aid, whether it's PEPFAR, some of those programs really impact us as well. And maybe the last thing I'll say is there are some other elements that are specific to our industry, but I'm sure you all have those in your industry that also impact us, that we are navigating, whether those are the Inflation Reduction Acts and what that means for the drugs, particularly drugs in pharma space like ours, are really important. So we have those external headwinds and tailwinds, I might say, and we have the internal headwinds and tailwinds as we think about the diversification strategy, the impact on the workforce, and obviously those things are never disconnected with the impact on the culture.
I'll add in one more for you, which is technology, and I'm sure that you guys have been working with incorporating AI for a longer period than just more recent history. But obviously things are moving quickly and changing. What do you, both when it comes to everything you mentioned, when it comes to technology and how rapidly that's changing and has a lot of impact on your industry and drug discovery, other things, what have you learned about kind of future-proofing, if such a thing exists, the workforce? Yeah. So you're absolutely right. Technology for us has been a big enabler, and we believe that technology, including AI, is a means to an end. It is not an end in itself. And when you think about, in our industry, when you think about the number of assets, the number of compounds that we have to screen to get to that one asset that we're going to move through development, technology has really enabled that for us in a big way. And that's not new to us. To your point, we've had that happen for a long period of time. When it comes to things like how do you select a clinical trial site, right? That's something that is deeply enabled by technology, and AI has a big role to play in some of those as well. So, and of course, within the HR space, we're also thinking about, whether it's the listening strategy, how do you get feedback and send employee sentiment analysis using technology and things like those. So those are elements that we are definitely thinking about. In terms of future-proofing the organization, for us, it's about thinking what elements of the job could be more efficient and enabled by technology, and where do you need the human judgment and the experience to really enable that. So it's AI tech enabled, but the human judgment and elements of it honestly is allowing us to think about what kind of jobs are going to change most rapidly over the course of the next 3 to 5 years. And as a consequence of that, what does it mean for the productivity of the workforce, for the effectiveness of the workforce? And how do we prepare and think about the skills and the programs that we already have in place to now get ready for this 3 to 5 year roadmap? Last quick question for you. We talked about leadership, inclusion, change management. How does leadership and your approach to it and your approach to inclusion impact your ability to navigate all of these dynamics today?
Yeah, so we believe that we started with everybody's a leader at Gilead. We believe that our leaders have a disproportionate impact on the culture. And that's why we have made these investments over the course of the last 3 years. We have an experience for our top 200 leaders that they went through over the last 18 months. We have 4,500 people leaders that have been through what we call a high impact leadership experience, HILS. And those are really setting the tone for, inclusion is a big component of that. It is an expectation, it's a core value, but it is an expectation from every people leader in the organization that they will create inclusion with their teams. And that looks different for different teams. And with those two elements coming together, as we think about this transformation agenda and the diversification of our company, we think that that's what is going to fuel back to this, allowing us to get the best products with the best people, right? So that's how we sort of connect. And these things take time. You have to sow the seeds, but we're already seeing some early impact of how leaders are navigating. Like I said, we had a reduction in workforce late last year, how they're showing up with people with care, listening, owning, back to all of our leadership commitments. It's been a great journey for us so far, and we're excited to see the full impact of that in the coming years.
Jyoti, thank you so much for joining us. Thank you.
Thank you very much, Michal. Great to be here.